the MAHOGANY study, which is evaluating a novel anti-HER2 antibody called Margetuximab, which is built on the trastuzumab molecule, but it's optimized the FC domain of the antibody, which binds to NK cells, natural killer cells, macrophages, etc., and enlisted as an ADCC response. And so that antibody is augmented in order to be able to elicit that ADCC response. And this now has precedence. It's been approved in later line breast cancer that's HER2 positive. And we conducted a previous study in the second line setting of gastroesophageal cancer that was HER2 positive. And in combination then with the second antibody, that's an anti-PD-1 therapy. And in the preceding study, that agent was pembrolizumab. And in the current study, that has been exchanged for a novel anti-PD-1 antibody called retifanlimab, which is another anti-PD-1 antibody that is being developed by Margetuximab. And so the preceding study was a single-arm phase 2 study of 92 patients that were enrolled in the second line setting, and with a response rate in all comers that were enrolled of around 18%. But as we've now come to understand that many tumors that initiate at the first line of therapy and are classified as HER2 positive, after progression on anti-HER2 therapy, a subset of those will become or evolve to become or select for pre-existing negative HER2 negative clones. And so at the time that was not being routinely assessed. And so patients who were considered HER2 positive to begin with were considered HER2 positive at second line without checking. And so inherently you would have some patients that were not having disease burden that was predominantly HER2 dependent. So with that background, we did look at patients that had ctDNA positivity that was HER2 positive just prior to starting. And as might be imagined, the response rates and the outcomes were enriched in that group, as were patients that started off pre-first line therapy with higher levels of HER2, IHC3+, not looking at IHC2+ and FISH positive, and also in PD-L1 positive tumors as opposed to PD-L1 negative. And when looking at those biomarkers, you started to see enrichment and benefit across the board in terms of survival, progression-free survival, and overall response rate. And so with that background, that led to the MAHOGANY study, which is looking at that same combination of therapy, anti-PD-1 plus anti-HER2 with Margetuximab, in two cohorts. The first cohort, or called Module A, is exactly the same chemo-free approach of just those two antibodies, but in the newly diagnosed first-line setting, untreated. They can have had prior therapy perioperatively, but that had to be remote more than 6 months prior. And patients have to be biomarker positive by two criteria. For HER2, it's excluding patients that are IHC2 plus FISH positive. So they're extremely high expressors, 3+ HER2, and they have to be PD-L1 positive, CPS 1 or higher. So there is a double biomarker selection there. And so it's a select group of patients, but because the response rates were quite remarkable, even in the second line setting of the preceding study of trastuzumab, the thought is that this would be a good hypothesis to test in the first line setting and potentially be able to spare patients from chemotherapy altogether. So that study is a single arm study with a response rate endpoint, and we do expect data from that in upcoming meetings. And then the second cohort of that study is a more traditional randomized study. It's set up first as a randomized phase 2 study, first with a control arm of chemotherapy plus trastuzumab, and then 3 investigational arms, one being chemotherapy plus Margetuximab, and then another investigational arm of chemotherapy plus Margetuximab plus an anti-PD-1 antibody, retifanlimab, and a third arm of chemotherapy plus retifanlimab plus margetuximab plus a bivalent anti-PD-1 LAG-3 antibody from the same company. And so based on that randomized phase 2 study, we will be assessing which of the 3 investigational arms might merit progressing on to the randomized phase 3 part of the study. So that part of the study is a global study, as well as the cohort A. Cohort A has been emphasized in the last year, and it's nearing its accrual of its first planned cohort. So we look forward to those results and should be seeing them at upcoming meetings.